Greetings, my friends. I am Adamu of the monadic entity of the Pleiadian civilization, and I'm coming to you, as always, through my beloved friend and scribe, Zingdad. It's interesting that we are having our third video about the coronavirus, and it's still not about the coronavirus, which I will explain in a moment, because first we need to talk about the coronavirus. And the reason we need to keep addressing the subject is it remains so central in your collective consciousness. It seems to be all you are really talking about. It certainly seems to be the focus of everything that's going on in your media at the moment. And this is not about to change anytime really soon. Very shortly, the public discourse will move on to discussion about the second wave. This being, of course, the idea that once the coronavirus has moved through a community, a country, any geographical group, that in a season or two it reoccurs, it comes back. And on the subject of coming back, something else that will be used to cause quite a lot of hype in your collective consciousness is the idea of reinfection. Those that have had the coronavirus get it again. And so with all of this hype going on in your collective consciousness, I thought it was time to simply plant some seeds of awareness. Not really about the coronavirus, but about consciousness. But as regards the coronavirus, my friends, you are being lied to. You are being misled. There are three very important numbers that are being horribly obfuscated in the reportage that you are receiving. And this obfuscation is leading to an utterly incorrect assumption about the coronavirus and its impact upon you individually and collectively. You are being manipulated with these lies. Allow me to explain. These are fairly strong statements. So the first obfuscation is the fact that the death rate, those that are dying of the coronavirus, that number is being inflated by correlation. This is truly a strong term, but this is medical fraud. Correlation is not causation. Allow me to explain what I mean by that. Correlation is not causation. Those who are quite profoundly ill with something else, cancer, heart disease, various other problems and diseases, if these people also contract the coronavirus and then die, that's chalked up as a number, a death, a tick in the box. They died of coronavirus. Indeed, there are reports of people dying in motor accidents. And when they are dead, they are being tested and found to have had coronavirus. Tick, they died of coronavirus. This is happening. So the so-called death rate, the rate of those expiring from the coronavirus, is being artificially inflated. Now, if we were being intellectually honest, we would at most label coronavirus in these cases as a comorbidity. And the truth of the matter is, in the overabundant majority of cases of coronavirus death, coronavirus is a comorbidity. It's important to note. And that's the first obfuscation of numbers. The second is the confirmed cases number. Medical authorities are usually only testing individuals that are already quite severely ill with coronavirus. If you go to your doctor or your hospital and you're a little bit ill, they will perhaps at a most run some other tests, but most likely they send you home without testing. Usually only those who are very severely ill and very clearly ill of coronavirus, showing all of those symptoms, we know what they are by now, are being tested for coronavirus. All others are being declined for testing. This drives the confirmed cases number down. Only the most severe cases become confirmed. Those with milder forms of coronavirus are often never confirmed. Not tested, therefore not confirmed. Now, if you understand statistics, this leads to a radically higher death percentage. Coronavirus is shown to be more deadly serious than it actually is. But the biggest obfuscation of all is the total lack of focus on the asymptomatic carrier number. This is a very important number. It's something that really should be central to your discussion. If you're going to be discussing coronavirus, you need to be discussing the asymptomatic carrier number. In the case of some diseases, you find perhaps a very small number of individuals being infected but never becoming ill. While not ill at all, they are, for a period of time, contagious. That is why they are called asymptomatic carriers. In the case of coronavirus, this number is remarkably high. In fact, this is one of the defining features of the coronavirus, that it produces such a very high ratio of asymptomatic carriers. What that number is, the actual ratio, will depend on the community. Healthier communities will have a higher ratio of asymptomatic carriers. If you're healthy with a good, strong immune system, there is every chance that you can encounter the coronavirus, take it into your body defeats the virus, but in the process, for a period of time, you are contagious, but not at all ill. There's a very good chance that happens. But in the case of coronavirus, there will almost always be more asymptomatic carriers than there are those that are ill with symptoms. Now, that's an important thing to be aware of. If, let's say, half of all of those that contract the coronavirus don't ever show symptoms, that will skew everything in the way you look at and understand the disease. But to date, this effect seems to be almost completely ignored by the authorities. So what does this all actually mean? Firstly, it means that the coronavirus is wildly more contagious than is being reported. Many, many times more people have actually been infected than we are led to believe. You might already have had it and not even noticed the fact. It's possible. You might already have had the coronavirus and had a bit of a raised fever. You might have had a little bit of a cough. You might have felt a scratch in your throat, and it might have passed before you got unduly alarmed, and you might have written it off as nothing at all. So that's one of the possible effects. The secondly, it means that while much more contagious than is being reported, it's far less virulent than you are being told. Now, what that means is if you are infected, you are far less likely to actually fall ill than you're being told. Thirdly, it means the hospitalization rate, the ratio between those that need advanced medical care consequent to infection, is much lower than is being reported. And finally, the ratio of those that actually die of coronavirus infection is much, much lower than you're being told. First of all, because far less of the people that contract the coronavirus die, and second of all, because people die largely of comorbidities. So what does this all mean for you personally? What should you do with this information? Really just this. Number one, if you are already in poor health, in other words, if you are already struggling and suffering, if your health is not good, then you should take all the precautions necessary to not catch the coronavirus. You should do all the things you're being told to do. You should self-isolate, you should engage social distancing, you should do all the hand washing, you should have the face mask. These are all of the other responsible protocols. We've spoken about the difference between other responsible, self-responsible, and unity conscious. These are the other responsible protocols. These are the minimum. You should be doing that. It's probably a good idea to be doing these things anyway. It's the basic minimum. None of these things will cause you harm. It's not a bad idea. Carry on and do these things. Secondly, everybody, irrespective of your present health conditions, irrespective of how you're feeling and what's going on, everybody should be actively working to improve their health in general and their immune function in specific. This is a good idea at any time. It's particularly a good idea at this time. This is where you bring yourself up to the self-responsible standard. This is where you show yourself that you can take care of yourself by having good health. Immune function is more than just good health. It's a specific focus on good health, but it also requires good emotional health, good mental health, good spiritual health. Your mood needs to be taken care of. You need to be taking responsibility for your thoughts. And you need to be working on your spiritual awakening. If you're doing all of these things, then your immune function will follow and you will have good immune function. It's a vast and complicated subject, far too much for this conversation today. These are things that will be addressed in due course in follow-up videos. The third thing that you should be doing, and as an advocate of the unity conscious path, I most of all recommend that you begin a daily practice of unity conscious protocols. Now, what these are, you can work out your own unity conscious protocols, but we will be sharing with you a particular program, a spiritual technology, if you were, that you can use to really powerfully raise your consciousness, to bring your divine light into your body, into your being, to radiate it out, to project an aura of wellness beyond your own personal space, to begin to elevate your frequency, to raise your consciousness. We will be talking about a daily meditation practice that you can do that will help you with this and so much more. Teaching you how to begin to awaken your divine light within, and to use that to heal yourself and others, to recreate your reality, to create your experience consciously. This is incredibly powerful stuff, my friends, and we will be leading you on the path of discovery in a step-by-step fashion. The first step is to begin a daily meditation practice. The second step is awakening your divine light within during that meditation practice. Now, fortunately, these two steps are already addressed in a powerful 30-day meditation workshop that Zingdad has previously created, made available for free on his website. And I cannot recommend this program strongly enough for you right now. Begin now. If you have never meditated before in your whole life, this series will help you to begin. If you are an advanced meditator with even decades of experience, this series will deepen your practice and will open you to the experience of your own divine light. Now, we will be taking you on a journey, teaching you to connect your divine light to the planet upon which you walk, to the sun above, teaching you to connect to the cosmos, be a child of this reality that you currently find yourself in. We will be teaching you to channel your divine light through your being, teaching you to use this divine light to heal, to transform, to create, to recreate. But it all begins with the ignition of the divine light within yourself. And that is exactly what Zingdad's 30-day meditation program entails. It's called, appropriately enough, Divine Light Ignite, and you can begin it today entirely for free on Zingdad's website. The link is on screen now and will be made available as well in the comments below. That's what you can do right now. This is how you begin to change the course of your life. Or of course you can keep living your life as you have been, and you can keep getting the results you've been getting if that's what works for you. Now, my friends, now is when you really choose your future timeline. This is your invitation. Choose wisely. And with that, I'm going to wish you goodbye for now. As promised, there will be follow-on. There's quite a lot to be said now. These are not times of despair. This is time of excitement. Magic and wonder abounds. Are you willing to co-create a future reality that excites and delights you and those around you? You have received your invitation. I welcome you to the process. Until next time, I am Adamu of the monadic entity of the Pleiadian civilization, and I truly do love you all with the heart of oneness. Until next time, goodbye.